Hello, my name is Lauren Chavis, and today I am going to be teaching you how to accurately perform a phlebotomy procedure. Phlebotomy is the process in drawing someone's blood, and it is done to test the blood for various diseases, illnesses, and abnormalities. It's very important, and you can learn a lot from just one single drop of blood from a person. So the first step in performing a phlebotomy procedure is to know your patient, number one, and know what tests are being ordered so that you collect the right tubes. Once you know these two things, you would then proceed to the patient's room and knock before you enter. So you knock on the door, enter the room, and introduce yourself. For example, I would walk into a patient's room and say, "Hello, my name is Lauren. I'm from the lab and I'm here to draw some blood. Is that okay?" You always have to get consent from the patient before you draw their blood. If not, and they didn't want their blood drawn, they can sue you and the hospital or whatever facility you work at. So it's very important that you have consent. Once you've introduced yourself and gotten consent from the patient, you will want to identify the patient to double check that you're in the right room. So you would ask the patient his or her name and date of birth. Then you would double check that with the patient's armband and their medical chart to make sure all the information is correct and there hasn't been a mistake made in the lab. So after you've identified the patient, you would wash your hands, make sure your hands are clean, with warm water and soap for at least 20 seconds. Once your hands are clean, you would come back to the patient's bedside and begin to assemble your supplies. So what you would need to perform a phlebotomy procedure is a tourniquet, venipuncture method of your choice or whatever your facility has. Here at the hospital I work at, we have butterflies, vacutainers, and syringes. I prefer to use a butterfly because I think it's easier. So I use that on pretty much every patient. So that's what I would choose to do my procedure with. Everybody's different. That's why there are options. You would also need gauze and an alcohol wipe, as well as tape. You'd also need the tubes that you will be collecting from the patient. So what you would do first is tie up the patient with the tourniquet about right here. You want to go above the bend of the arm because that's where you're going to be feeling for a vein. Once you have tied up the patient up here, you will palpate the area to find a good vein that you think will work. Once you have found a good vein, you will take your alcohol, clean the area really good, allow it to dry, and then you would stick the patient with whatever venipuncture method you have chosen. You will then put the tubes in the correct order of draw to collect the blood. When you are finished and ready to take the needle out, you will place gauze over the needle while it is still in the arm and then pull it out and deploy the safety device. And to make sure that the needle is secure and you cannot be stuck. You would want to hold pressure over the site that she's stuck to help stop the bleeding. Once you've held pressure for a few seconds, you can go ahead and put the tape over top of it. And you would also want to pop off the tourniquet. I keep forgetting that step because it's not actually on the arm. But you'd want to pop off the tourniquet. You always make sure that this is off of the patient's arm because if it stays on for too long, which to kill them it would take hours, but always make sure the tourniquet is off of the patient's arm. Once you have taken the needle out, patient is taped up, and you have collected your blood, you will then label the tubes at the patient's bedside to make sure that they belong to that person, because if you leave a patient's room with unlabeled tubes, there is a good chance that you will forget who the patient was if you have a high patient volume. If you only have a few patients, maybe not, but it's still safer to go ahead and label tubes at the patient's bedside. And once that is complete, you will thank the patient and leave the room. And that is how you perform a successful phlebotomy procedure.